The Broward mayor says he has a way to keep people safe, but he says he needs the governor's help. Local 10 News reporter Hatzel Vela is live with what he just learned. Hatzel.
Well, Nicole, it looks like the mayor is not going to get help from the governor, but he says there are laws on the books here in Broward County, and they just need to ramp up enforcement. Governor Ron DeSantis once again reminded us Monday there won't be any more economic shutdowns.
I want to avoid an economic possible.
But Broward's new mayor, Steve, you cannot be anti-mask and anti-shutdown.
I am duly qualified to hold office.
It was on his first day as mayor, Geller sent the governor a letter asking him to institute a statewide mask mandate. In the letter, he says it is unclear how one can be considered pro-business without being in favor of mandatory mask wearing. If we don't have a statewide order mandating mask wearing, I fear that a broad business shutdown may soon become necessary. Geller wants the governor to remove Section 4 of his executive order, which suspends the collection of fines and penalties associated with COVID-19.
We intend to vigorously enforce the ordinance.
That means citing those who refuse to wear a mask and issuing fines once the emergency order is over. That even includes businesses.
We can still fine and shut down businesses that are not enforcing mask orders.
He says the best way to avoid shutdowns is simply wearing a mask and social distancing.
To be clear, there is no constitutional right not to wear a mask in the middle of a pandemic when ordered by your government. Period.
So the mayor will be meeting on Thursday with the Broward League of Cities. On Friday, he'll be meeting with other mayors to discuss enforcement. Reporting live tonight from Fort Lauderdale, I'm Hatzel Vela, Local 10 News.
Okay, we'll stay tuned. Thank you, Hatzel.
On to the coronavirus and a new grim milestone here. Florida has topped more than 1 million cases.
And it comes on the same day the CDC discussed who should be first in line to get the vaccine. Local 10 News reporter Amy Viteri is live at JMH with it all. Amy.
Well, tonight, a panel of advisors to the CDC voted 13-1 to give frontline healthcare workers as well as nursing home residents first access to a COVID-19 vaccine once it's approved for emergency use.
We're going to have to prioritize, and you have to base it on where do you get your most bang for your buck.
Logistical preparations well underway to distribute a COVID-19 vaccine, waiting for the moment the FDA greenlights emergency use. Tuesday, a panel of advisors to the CDC voting on who should get the vaccine first. Infectious disease Dr. Eileen Marty says the focus will be on how to make the biggest impact, inoculating frontline medical workers first, but should essential workers and nursing home residents also get priority?
Of course, everyone wants to be first on the list, and the biggest issue, as you mentioned, is where do seniors stand on the priority list?
Charlotte Mather-Taylor is executive director of the Area Agency on Aging of Broward County. She says many seniors who have spent the year in isolation are desperate for a vaccine.
If you're in a long-term care facility, of course, you're worried about catching it from one of your neighbors, your family members aren't coming to visit you as much. And so there's a sense of loneliness that occurs.
The state has a draft vaccination plan which lays out a phased approach, focusing first on healthcare providers, then essential workers, followed by the medically frail and those over 65.
There just is not enough. So they still have to target the highest risk people first.
Again, that panel of advisors to the CDC recommending both frontline medical workers as well as long-term care facility residents be included in that first phase of the COVID-19 vaccine distribution. Remember, that vaccine first needs to be approved before it will be available to the public. Now, ultimately, it is up to the state whether it wants to follow CDC guideline. Also, state health officials have until Friday to submit their final vaccination plan to the federal government. We're live at Jackson Memorial Hospital. Amy Viteri, Local 10 News.
Amy. Big news about the pandemic today. Florida has now passed 1 million cases after adding more than 8,800 new cases today. 82 new resident deaths were reported statewide. Miami-Dade adding more than 2,100 new infections of the virus. The county now has more than 231,000 cases, along with 4 more deaths today.
801 new cases were announced in Broward. No new deaths were reported in the county. Broward now has more than 108,000 cases. And there's 11 new cases in Monroe County, and 1 new death was announced. Monroe has more than 3,300.
Big news about the pandemic today. Florida has now passed 1 million cases after adding more than 8,800 new cases today. 82 new resident deaths were reported statewide. Miami-Dade adding more than 2,100 new infections of the virus. The county now has more than 231,000 cases, along with 4 more deaths today.
801 new cases were announced in Broward. No new deaths were reported in the county. Broward now has more than 108,000 cases. And there's 11 new cases in Monroe County, and 1 new death was announced. Monroe has more than 3,300.
Down to the latest numbers in the pandemic today. The state reported more than 6,600 new cases, leaving Florida with just 681 cases away from the 1 million mark. There were 97 new resident deaths. More than 1,900 new infections of COVID-19 in Miami-Dade here. 1 person has died in the county, and 826 new cases were reported in Broward County, along with 5 new deaths.
Meantime, local hospitals are preparing for a possible surge in cases after the Thanksgiving Day holiday. They're bringing in extra help as a result. At Memorial Healthcare System, Chief Nurse Executive Maggie Hansen says their staffing agency has already brought in 100 traveling nurses to help through December, as a case surge could put a strain on the hospital's staffing.
It's kind of frightening for us because we've been at this for a long time, and our nurses are getting a little bit tired. And on top of that, we probably have a dozen respiratory therapists that are here on the ground right now, and we'll anticipate needing to hire more for January.
Well, today, Governor Sanders, as you saw, also spoke about making sure hospitals have the capacity they need to help patients as COVID-19 admissions continue.
Let's get a check on the pandemic so far. Florida reporting more than 7,300 new cases yesterday, bringing our statewide case total to more than 992,000 statewide. The positivity rate right now, 7.8%. Miami-Dade seeing more than 2,000 new cases. 821 infections were reported in Broward, and 32 people now infected in Monroe County. Those numbers are expected to go up. Keep in mind, after testing ramps up after the Thanksgiving holiday, and the concern is it's going to cause an influx in hospitalizations as well. Local 10's Christina Vasquez live at Jackson Memorial Hospital with more on this.
And you make a good point there, because it is the recommendation from public health experts that if you were traveling during Thanksgiving, whether you traveled here and are leaving to return home, or any kind of exposure to multi-generational households, even if you were in South Florida, to go ahead and get yourself tested throughout this week. So good point there. We're going to go through some data points here just so you get a current picture of where we are when it comes to hospitalization. So let's start with some statewide data. This is from the COVID Tracking Project. So according to them, in Florida, hospitalizations are at their highest point since August. And they also say the number of people hospitalized now is twice the number hospitalized in mid-October. Now we're going to break it down into some data points coming from Miami-Dade County. This is that daily COVID-19 dashboard, and you will see there a steady rise in admitted patients. Now this includes data through yesterday, so it does give us an indication that some members in our community did spend Thanksgiving weekend being checked into a hospital. Let's now go to Miami-Dade fire rescue calls. There you will also see an uptick in suspected COVID-19 calls. Over the Thanksgiving holiday, I had an opportunity to speak to the president of the largest union that represents Jackson healthcare workers. And one thing that she mentioned that I wanted to share with you is, if you remember during the summer when we saw a case surge after Memorial Day, and we started seeing what we're seeing now, the steady increase in admitted patients into hospital. Once we got to the point where we really began to see a hospital surge, if you recall, The governor of Florida at that time dispatched about 100 nurses to South Florida to help them with staffing. So one thing that's on her mind looking forward as we get through the next 2 to 4 weeks is if we don't see community compliance, especially as we continue on our track through the holidays, right? Up next is Christmas. If folks begin to not practice personal responsibility, and because of that, we begin to see mounting pressure on ICU beds again, she is curious to see if there is a plan in order to send more nurses to relieve us. I did ask that question of the governor's office this morning. I have not heard back, but because that's an outstanding question, or we're not quite sure what the next couple of weeks will look like, one thing is for certain is this steady increase in the hospitalization numbers is why she really pleads with you, especially as we lead into December and into the new year, to take some personal responsibility. Let's listen in together.
So we really need the general public to please take heed, wear a mask, wash your hands, social distance, and keep the holiday crowds to a minimum. It's once in our lifetime, but it makes a difference of a lifetime.
So from her point of view, the health of our healthcare workers, of our neighbors and loved ones and colleagues is really in your hands. I did check in with Baptist Memorial in Jackson to get some updated numbers from them. As soon as I have them, I'll be sharing them with you. Reporting live, Christina Vasquez, Local 10 News.
And on that note, we know a number of decisions are set to be made between now and the end of the year regarding the COVID vaccine. Tomorrow, the CDC's Advisory Committee on Vaccines will hold an emergency meeting to discuss how to prioritize a vaccine. Then on December 10th, an FDA Vaccine Advisory Committee will meet to consider Pfizer's vaccine for emergency use authorization. The first round of those vaccines could be distributed 2 or 3 days later. And then by the end of 2020, around 20 million people could receive immunization.
LA, something of a ghost town for the next 3 weeks or so, and that, as Moderna's news means that a viable vaccine becomes more of a reality. The company says that its vaccine is considered 94% effective, and it hopes to have FDA authorization by the end of December.
This morning, Moderna announcing it will file for emergency use authorization for a vaccine considered 94% effective across age, race, and gender. It will require 2 doses. Moderna's vaccine uses messenger RNA that triggers an immune response, creating antibodies to fight off the virus. And unlike Pfizer's vaccine, Moderna's can be stored in standard freezers for 6 months and in a refrigerator for 30 days, something that experts say will make it much easier to get to rural areas. As for Pfizer's vaccine, while doctors are not allowed to administer it yet, sources tell us this morning United Airlines started shipping it through charter flights to get them in place for distribution in anticipation of Pfizer getting that emergency approval.